6:27. Actually, it's 6:28. So while you enjoy your cup of goodness, or maybe you're the sort of person who likes to have a huge breakfast, like food from yesterday you're having for breakfast, well, enjoy as you enjoy the show. But we want to start by telling you the good news. The palace has announced that Prince William and Kate are having another baby. So baby number 3 is on the way, but she has had some challenges with extreme vomiting. So Dr. Lord is here to talk us through this situation, which he calls hyperemesis gravidarum. Good morning, Dr. Lord.
Good morning, Cassandra. Good morning, Shane.
Good morning.
Let's hear what it's called.
Huh?
Let's hear it.
Let me look at it, Bobby. Hyperemesis gravidarum.
Right.
There you go.
Go to the top of the class. Yeah, hyperemesis. Hyper meaning excessive. Emesis is vomiting, and gravidarum of pregnancy.
Okay. But before you deal with that situation, just take 30 seconds to indulge me. What do you prescribe for forgetfulness?
Forgetfulness. Well, you just have to organize your head, organize your thoughts.
Right.
If you're doing too many things, you know, I know you had a busy weekend, a lot of stuff, you might forget some stuff. So, you know, yesterday,
even if you're
birthday,
constantly reminded?
yeah.
Even in situations like that?
You shouldn't.
Is this a precursor for Alzheimer's?
No, that is just excessive forgetfulness. It's not Alzheimer's.
Excessive forgetfulness?
Yeah.
I like how you put it.
Dr. Lord, you do agree that people must make their presence felt.
Yes,
Okay.
and I think that if you have reminders and so on, you should try to remember things. But
People
sometimes
must
this
make
has
their
happened.
presence
Yeah.
felt.
Yes.
So, this session is brought to you in association with Great Health Works. We're going to talk about that right now.
Omega XL.
Yes, we're going to talk
And that
about
will help.
Dr. Lord, you're just bad. You're encouraging him. So tell us about this situation. When exactly does it set in?
Yeah, hyperemesis gravidarum sets in obviously in pregnancy. The first 5 to 13 weeks, 4 to 6 weeks, you first get some symptoms of vomiting. It's not unusual for women who are pregnant to get early morning sickness. Sometimes even the men sometimes have symptoms of vomiting sometimes. But yeah, it usually sets in the first 4 to 6 weeks of pregnancy. Sometimes peaks between 9 to 13 weeks, and by 20 weeks it usually goes. But some persons get excessive vomiting, which is something different to morning sickness. And the cause really is not known. It's thought to be due to excess amount of hormones that the body has now. Estradiol is high there during pregnancy. Sometimes it can be due to multiple pregnancies if the body have twins or triplets. That causes even higher levels of estradiol.
Wow.
Or sometimes the placenta may overgrow and cause you to have this problem. Or maybe you have what's called trophoblastic disease. May have a mole or abnormal pregnancy, which can cause hyperemesis as well.
What about nearly back-to-back pregnancies? Because I know that, her last baby is still, I don't think even a year yet.
But I love this. It's real life. This is what happens in real life. It's good to see that those folk are having real life situations.
Yeah. It's not so much to do with back-to-back pregnancies. If you've had it in one pregnancy, you're likely to have hyperemesis in another pregnancy.
And she has.
And she's had it in both her pregnancies
So
before.
does something predispose you to this, or not?
We don't know. We think it could be genetic. Sometimes, as I said, the high hormone levels, but nobody is 100% sure what really causes this high level of this excessive vomiting. It is normal to vomit during pregnancy, or not vomit, but feel nauseated. But excessive vomiting is when this hyperemesis comes in.
Well, could it also include things like vertigo? How does it really impact the body?
Well, some of the symptoms of hyperemesis gravidarum include nausea, as I said, accompanied by vomiting, as opposed to morning sickness where you might not get vomiting, might only be nausea. And usually it can cause severe dehydration as well in hyperemesis gravidarum. And it doesn't allow food to stay down in hyperemesis, whereas in morning sickness you still get some food staying down. And in morning sickness, by 12 weeks it's gone. As I said, in hyperemesis it can go on throughout pregnancy, 20 weeks. Sometimes 20% of women have hyperemesis right throughout pregnancy.
How could this affect the unborn child? Will it have any impact? Because you say the food doesn't stay down. So I think that, that lack of nutrition for the fetus, that could be an issue.
Correct. That is the big issue that occurs. Usually that fetus depends a lot on the mother to get nutrition. And if the mother is not getting anything, it can affect the child. And therefore, low birth weight children are likely to occur. And if it gets so very severe, then a premature birth, early termination of the pregnancy by cesarean section in order to have an early delivery, because then the mother can be severely impacted by the dehydration and lack of, because they can sometimes lose up to 5% of their body weight. You know, in pregnancy you put on weight, and these people with hyperemesis does the thing. But yes, the fetus could be affected, and a low birth weight baby. Luckily in Barbados we have a very good neonatal intensive care unit, but that costs a lot to run, and sometimes these babies can have other problems as a result of the low birth weight, low weight at birth.
So what can be done to help deal with that? And if indeed the mother is not getting to keep any of the nutrients in, what can be done? And I want you to think on that. We're going to take a quick break, because this is Doctor on the Line, brought to you in association with Great Healthworks, the distributors of Omega XL.
This is a serious problem in Trinidad. What is diabetes?
There are two forms. Diabetes type 1, when your body stops producing insulin. Type 2 diabetes is a result of poor lifestyle. Type 2 diabetes is associated with being overweight, having high blood pressure, at higher risk for heart disease. It is a very serious problem.
Do not wait until it's too late. Let Omega XL be the first step in the right direction.
Get your Omega XL today. Live long, stay strong with Omega XL.
So before we move on to some of the other symptoms, some of the ways to manage this situation, which we're talking about with Dr. Adrian Lord, OBE, hyperemesis gravidarum, we are going to talk more about some of the things, the other symptoms persons can experience.
Yes, Cassandra, besides the nausea and vomiting, which can be very severe, you live almost near a sink or a toilet, but you can get fainting or low blood pressure, rapid heart rate can occur.
Wow.
Get decrease in urination and weight loss, as I mentioned, up to 5%. And the person becomes dehydrated, the skin loses its elasticity, headaches, confusion because of lack of nutrition going to the brain. Jaundice can occur as well. Extreme fatigue, and the heart rate, as I mentioned, can be fast. And then when we do the urine test, and every pregnant woman who comes to the doctor should have a test done of urine, because you get a buildup of what's called ketones, which is a breakdown product of the fats and so on. Because the body tries to keep the nutrition, because it tries to keep that child healthily, nutritionally supplied with nutrients, and therefore it can cause ketones or ketosis, and that is a cause for hospitalization when you see that ketones in the urine.
What would be the response then to hyperemesis, as far as trying to quell it, to make sure that you don't lose those fluids, you're not as dehydrated, to reduce the vomiting especially?
Yeah, most women take to bed because they're weak, tired, they feel fainty because of the low blood pressure and so on. You need to take sips of fluids in the hospital. We used to give them some ice to start to suck on, and then sips of liquids. Using an antiemetic, which is something to stop the vomiting before eating, half an hour before eating. But as you know, some of those tablets that you take can make you feel sick too, or can make you feel drowsy. But you have to be careful, because the person is pregnant, and early in pregnancy this thing occurs. You don't want to take anything that would affect the developing fetus. So this is why the doctor has to recommend certain medication that safely can be used in pregnancy without affecting the developing fetus. And using dry foods and bread and toast and biscuits and peppermint tea or herbal teas does help a lot. And then if it's so severe that you're not taking anything, then you need to get a drip, intravenous fluids with the various nutrients and vitamins that you normally would take in your diet, or tube feeding, where they put a tube through the nose and get in that nutrients. Because you need to keep that baby, you don't want that low birth weight baby that might have respiratory depression or brain problems or whatever. That is a big problem. So yeah, you need to do what you have to do to maintain that healthy baby, and of course make the mothers comfortable and the father too.
So as far as you know, what is the latest with the Duchess of Cambridge?
Well,
what's happening with her? What are they doing, the doctors? What are they doing to help her situation?
Well, we haven't been told, but she's had this on 2 occasions before, and she knows the drill, as we say here at CBC. We know the drill. So she would be obviously looking out for this problem. It's likely to happen if it's not happening already. I know that sometimes because of it, her public appearances are reduced and so on. So yes, she would be on her anti-emetic or anti-vomiting medication. She would making sure that she's taking her liquids, and if it gets really bad, then she would be hospitalized to get that IV fluids.
To the best of your knowledge, Dr. Lord, how common is that condition in Barbados?
It is very common. It is not any more common in Barbados than other places. It's not more common in blacks than in other races. But 20% of persons have it going right through pregnancy. As far as how frequent it is, up to 2% of pregnancies can have this hyperemesis. Most pregnancies may have morning sickness, but then in pregnancies, a lot of them can have 2% can have hyperemesis, which is excessive vomiting.
I had asked you earlier about the possibility of feelings like vertigo. I mean, it just sounds like with all that going on, you just could feel very unstable. Is that a possibility as well?
Yes. I wouldn't really call it vertigo, I'd say dizziness, or lightheadedness, where because you're not getting that energy, you're not getting that glucose in the body, your blood sugar drops and your blood pressure drops, and therefore you feel very lightheaded, and that's why the women tend to take to bed. You can't move around. Sometimes you feel the room is spinning as well, but that along with nausea, that's why it's so difficult. People go and diagnose vertigo, and it might be just the person might be pregnant. Some people come in the office and say they have vertigo, and then when you check, the person's pregnant, having nausea and dizziness because of the morning sickness or hyperemesis. So there are a lot of what we call differential diagnoses for these symptoms that one need to look at whenever you have any symptom, any condition.
Okay.
Yeah, it's a wealth of information from our very own Dr. Adrian Lord, OBE, talking about hyperemesis gravidarum, a situation.
You got it right.
Yeah, I got it right. Situation affecting the Duchess of Cambridge. 20 minutes to 7 is our time. At the top of the hour, we have our news. But again, thank you, Dr. Lord. Of course, Dr. On The Line brought to you by our partners, Great Health Works, the distributors of Omega XL. We'll take a short break, and then Cassandra, she'll get into a chat with an interesting young lady about some of the good work that she's doing.
Dr. On The Line was brought to you with the compliments of Great Health Works, agents for Omega XL.